Hey everybody, John Millen with PPG Solutions here with Deborah Willis. We have a guest from Kerr Advantage, the CEO and president of Kerr Advantage, Tim Hanold. Tim, thanks for joining us today.
My pleasure. Thanks for having me, guys.
So we're excited, Deborah and I here. Deborah has a lot of experience in the healthcare community, 40 years at least, and just a great wealth of resources. And you work for a premier home care organization, Kerr Advantage. And so we thought we'd ask you a few questions, allow you to share a little bit about what you've done, because it seems like you guys have done a really great job working through the last 3 months with the COVID pandemic. So we're looking forward to talking to you.
Yeah, Tim, I'm so glad that you agreed to do this because we've been looking at all the industry leaders in healthcare and being able to determine what made you different, what made you start so soon with trying to be able to be proactive with the COVID that was happening all around us.
Yeah, so I think part of it's kind of our culture and our nature. We really do try to lean towards being thought leaders and kind of on the forefront of things as much as we can. Now, I mean, there's that, there's a desire, and then of course there's actually doing that. And so we're always connected with other industry leaders, whether here in the Mid-Atlantic area or others, I have some good connections with some previous colleagues back in New York, and obviously it was something that became a very, very real thing there faster than it did for the rest of the country. And just from some of my conversations and discussions with them, they're saying, hey, this is something that is it's not going to just be a New York thing, but it's going to be something that's going to really spread across the country. And so prepare, get ready now. So. And that was really the end of February and the beginning of March. Really in earnest, we really jumped into it here at Kerr Advantage and started planning and preparing to get ahead of a pandemic, which doesn't happen that often, does it? as much as we could. So a lot of lessons learned. We evolve every day. There's no question about it. But we do feel good about just kind of a jump start that we got on it.
Yeah, I agree. And when you and I spoke earlier, you talked about evolving and learning and being able to be ready to be able to tackle this. And one of the things that resonated with me was your concern for all of your employees. How did you get the message out? How did they receive that information?
Yeah, so we're fortunate to have a marketing communication department within our company, and actually, you all have had an opportunity probably to interact a little bit with Bree.
Yes, yeah, I know Bree from before, from for a long time ago.
That's right. Yep. So Bree's been a core part of Kerr Advantage for many years. So. So anyway, we do have a mechanism already in place, in lots of different mediums and ways that we get the message out to our teams. And so, it's communicate early, communicate often, communicate in a really clear way, so that it's just very, very, very obvious, the message that we're getting out there. And then also in a way too that's heard and felt, we're talking about our culture. So. Started by Debbie Johnson, so it was a family business, and we continue to really started here in Richmond back in 1988. So incredibly deep roots here in Central Virginia, and we're always our responsibility is to take that forward. And Debbie's still on our board and a very important ambassador and part of our company. So getting that part set was. Then getting into the details of the protection around the PPE, which is an acronym that everyone knows now, right? The personal protective.
Absolutely.
Our confidence in care and our caregivers' ability to deliver that care really started with our ability to get in mass quantities of PPE, which was we're talking about learnings and a journey that was really difficult up front. But again, we were talking about kind of the preparation. Maybe we got a little bit of a head start out of the starter blocks was that we were able to source PPE quickly. I mean, and that's something that I'm sure that other business owners, especially in the healthcare perspective, didn't see that cost coming, right? Didn't see the volume of that need, and our nurses and therapists and caregivers do always use gloves and masks, but but not nearly in the same quantity and the same level that you're seeing today. And then also, so from the PPE to different process and protocols to different requirements around training for our caregivers around how to just protect themselves, do their part, but also protect their family, their patients, and who they're interacting with. So it really turned into a very kind of like well orchestrated communication plan to make sure that they were aware and also knew about the levels of support that they had through Kerr Advantage.
Well, hearing that you said it was well orchestrated, I think is a feat unto itself, because I know other people had a lot of challenges, especially getting hold of the PPE equipment. It became more and more difficult as the need was arising. So how many people were you servicing at that particular time to be that proactive so quickly?
Yeah. So like on any given day, again, we're across the Mid-Atlantic region. We're servicing anywhere between 3,000 to 3,500 families. And wherever home may be, right? Whether the one-on-one care within a home itself or within communities, because a lot of times they're looking for that additional layer of support. And then of course, that's then you kind of marry that up with maybe 4,000 or 5,000 active caregivers and nurses that at any given time are taking on those clients, those patients, in those cases. So we started to feel like an Amazon distribution center. We were sourcing this stuff and still are. But especially, we had kind of a bolus injection of this stuff for the last 90 days. And something that we had to be careful about, think about business considerations, cash flow, right? Because we were spending hundreds of thousands of dollars on incremental PPE that in the past wouldn't have been at that same pace. So we had to be really mindful about that, and also cost containment and things of that nature to make sure that, we're paying the bills, paychecks, and everything else just keeps on moving, without anybody missing a beat, which obviously we stayed ahead of. But the PPE was coming in from China, coming in from India, coming in from California. It was from all these types of distribution points, and some of our senior leadership, specifically Kathy Dancy, our Vice President of Human Resources, she became into our self-proclaimed PPE czar.
A new title.
It's incredible, the amount of coordination. She has like a degree in supply chain management now, I believe.
Wow.
So just feeding all these different regions and all these different branches, because at this point we have 40 full office distribution points throughout the Mid-Atlantic. So make sure that they have everything from gloves, to the masks, to gowns, to foot coverings, you name it, to make sure that everyone feels safe with going to work.
Well, feeling safe, I think, is really important. I know that one of the problems that we've had in some of the area here in Richmond and surrounding areas is a fear factor that many of the employees had, because they did not feel like they were being protected, and therefore they didn't provide the same kind of care for their patients, because they were also fearful about taking this home to their families. So education and training, I hear, is a key, and something that you jumped on immediately.
Yeah, and I'll just add to that. Our nurses, oh my goodness, where would we be without our nurses? Pre-COVID, post-COVID, right? But the way that they've stepped up and just kind of stretching out, their role and what they provide. I remember, earlier on, we were talking to some of our nurse leadership, and some of the things they were talking about wasn't necessarily, that hands-on care or, certain process and protocols are obviously very important, but sometimes those things are, kind of things that come to the top of the order on how we're, checking all those things off. But they're talking a lot about individual one-on-one conversations with the clients, patients, and caregivers, just having them rest assured around, alleviating anxiety and fear that, like, listen, we're doing all these different things, and everyone's doing their part, and you will be safe, and we're providing, a safe service to the families, but also our caregivers had the confidence to go out and perform that. So our nurses, became like, behavioral health experts or tapped into that extra part of their, their past or their history. And and just alleviating anxiety was a big part of their job.
So I'm hearing that everybody really stepped up, even outside of their own comfort level, to be able to provide the quality of care that you all have always done for Richmond and surrounding areas. And that's quite a testament to the way you operate. And you know, one of the things that John and I really appreciate is because I'm so engrossed in healthcare, but he's been in the industry for a long time in terms of healthcare insurance and being an excellent healthcare insurance provider, and being able to say, okay, what is it that he did? What is it that you did? Even though you have different companies, but yet similar values and a similar approach to being able to take care of your employees.
Yeah, one thing, Tim, that we learned is, you know, our clients are companies, so we obviously weren't visiting companies anymore or out in the field. We were working remotely, so instantly we had to figure out, okay, we've got 5 really solid rock star people in our company. Now we've got to mobilize, and everyone works from home, which is a challenge. If you're not used to working from home, they were carrying out displays and cables and like there's all this stuff taken home. But that was just the start. And then as leaders of the company, my wife and I, who's also the senior partner, we were like, okay, what do you do if people start getting sick? Whether it's COVID or not, what if they're sick and then they're stressed and they're at home and the kids are home? So we found ourselves relaxing our vacation policy, saying, hey, if you don't feel, if you're sick, don't work. Like don't worry about the vacation days. Don't worry if they haven't accrued. We'll worry about that stuff later. And the other thing was keeping connected. So a lot of the things we did is we have a daily training every 8:30 a.m. to 9, Monday through Friday. We've been doing this for over a year and a half, and we just intertwined what was going on. And the first couple calls were like, how you guys doing?
Oh, yeah.
What's going on? It wasn't even about business. It was about, Tim, how you doing? And we'd hear all kinds of stuff like, my kids are home, and you know, this is going on. My husband lost their job. And so from a leadership, even it's a different industry, I think all leaders of different companies, whether they're the size of you guys or the size of us and in between, we all had to pivot really fast and make the best of it.
But you know, Richmond is a unique area. You know, we all know that Richmond is very unique. And of course, what's going on right now is disturbing. But one of the things that I am finding is that people are rising to the occasion, that people really are embracing Richmond, and they really feel so loyal to Richmond. And I think that this resonates in the community, be it healthcare or be it whatever industry it is. And to me, knowing that we were all doing this together, and knowing and seeing, I was watching you, I was listening to you, I was listening to a lot of people, because we never missed a beat. You know, we slowed down a little bit because we had to reassess everything, as I'm sure you did too, but we never missed a beat. And just like you feel about taking care of your clients, we do too. And we never missed a beat with that, and we became actually even more busy, unbelievably so. And I think was that true of you as well?
Yeah, we had some ebbs and flows with it. So up front, I'd say 15 to 20% of our business in certain regions, the families were saying, "Hey, we're gonna put services on hold for a period of time, trying to figure out what's going on. I'm home anyway," right? So that was happening at that point. So either folks who were doing work at home, they were furloughed, or a number of folks that lost their jobs too, right? So.
Right.
You know, obviously we all have family members or friends or neighbors that are going through all types of different economic pressures right now. So, but there was families that said, "Hey, we're going to put this on hold." And then what we found over the last, really over the last 4 weeks, a lot of those families had started to come back. But there's also has always been just a consistent flow of need. I mean, elder care, right? It's something that every single day there's, you know, that need does arise. One way or the other, whether it's a crisis situation for a family or just kind of, pre-planning. And so we fortunately have been very consistent with that need and meeting that demand. And another thing that we did in regards to evolving and preparation was that over the last, I'd say 4 to 6 weeks now, we've been taking on COVID positive patients in the home. And so they're discharged
I heard that.
in skilled nursing homes and things of that nature. And we're one of very few, especially when it comes to personal care across the Mid-Atlantic, who raised their hand and said, we're prepared, we're ready to do that. So that's another level of demand that is coming through the door that certainly wasn't something that we had coming in, just 120 days ago.
Well, kudos to you for that. Because not everyone was able to do that. And, that you were a leader in that particular aspect as well speaks volumes. One of the things that I know also about Kerr Advantage is that you do a lot for the community. And so can you speak to that a little bit, Tim?
Yeah, sure. So from, a big event like our social worker Circle of Care, which I know you know quite about, and so like you're really celebrating social workers and their hard work. And actually it was the week where, actually the second week where, COVID really hit in a very meaningful way in Virginia. That was supposed to be our annual event. So, it's too bad. And we had a terrific event set up at the Jefferson, a way to really just celebrate social workers, obviously along with our nonprofit partners every year. And in this case, Massey cancer. And so, but yeah, it's that'll be on later. But that's a really great example of, that's one kind of like large event that we're instrumental in helping to celebrate social workers. And then other than that, it's I think what we take a lot of pride on is what we do locally, whether it's in Emporia or Roanoke, or what we do in Salisbury, in Delaware and Maryland and some of these other places, is just what we're doing with the local community on a multitude of different events. And we just try to be very present and just because obviously we are our community, so people helping people, and it's definitely woven into our DNA.
Well, you've certainly been a wonderful example of doing that, and it's just been a real honor to get to spend some time with you and to be able to share some of the experiences that you had, and hearing that you had somebody in New York saying, hey, listen, you need to pay attention to this. I think was certainly great that you listened to them, because they've certainly been through it themselves.
Sure.
I know.
Hey, Tim, one final question, and I don't know if this applies to you specifically, but my understanding in the industry of home care can be very price sensitive, right? What's the cost per hour? And I'm wondering, there's certainly things you guys do above and beyond that provide huge value. Have you found the things that you've done, do you think that's going to help add more value to your package, where people may not be so sensitive to the hourly rate, where they'll be like, for my mom and dad, I want the best for them? Do you think that's going to help you guys in that regard?
Yeah, it may. When it comes to the kind of the decision making around home care and anything elder care, it's a very different, kind of like purchasing behavior or thought pattern versus some other things that we have a lot of history and data points in making, right? So it's and it's not something that you're not perusing elder care on the weekend, like as the adult son or daughter or whatever. It's just typically it's like, now what? And you're getting really good guidance from just physicians and the healthcare community. A lot of times it's in the hospital, with those clinicians and so forth. But I think this will continue to bring the light, just the quality of care, and whether, regardless of, where that happens, whether that's in a hospital or a rehab or, an ALF or an ILF, independent living facility, assisted living facility, or, our type of care of, that direct one-on-one care in the home. It's how well do you take care of your we call them our care family, but your employees, your caregivers, your nurses, your therapists, and are they really exuding the values of the company? And I do feel that families will pay more for that, and they might actually pay more attention to that moving forward after going through something like this, where high quality delivery is really obvious on what's happening right now, and then those that are on the other side of the spectrum, that's unfortunately obvious too.
Well, one thing I want to close with, Tim, is because this is going to be going to other businesses other than just healthcare, and we'll have some business presidents and some business people looking at this. Can you quickly go over the levels of care that you provide, what it is that you do, and how people can reach out to you?
Yeah, certainly. So we provide care in the home, and that's wherever care may be, that care setting. And anywhere from, companionship care, we're helping with just kind of daily activities of living, as, what we would call it, to even much more higher acuity to care, which, medically complex and folks that really need a lot of attention. So, it's just a handful of hours a day to around the clock, nursing care. We cover that entire spectrum. And also a key component to our company here in Richmond is that we also have a skilled division. And what we mean by that is therapy and nursing right after, discharge from a hospital. So we really do have that full continuum of care, and really kind of one call does it all, if you will.
Yeah.
So anyway, we're, and with that, we're prepared and ready. And if a loved one, for one reason or another, does end up with COVID, that's someone that, you can lean on us to be a great support and resource around that.
Well, one more. I know I said final question. I've got one more. I'm so sorry. If you know me, you know that I might do that. But in terms of COVID, how have you seen the numbers going? Have you seen a big reduction in some of the discharges that you're having that require just your normal rehab care as opposed to COVID care?
Yeah, so with elective surgery opening up not too long ago in Virginia, and just recently in Maryland and DC, so that the kind of we'll call it the normal flow of patients and folks and families looking for our type of care, that's starting to come back right now as we speak. And then over the last month, we saw a real surge and spike with COVID positive care in the home. And so fortunately, from what we've been able to experience, we've come home, been able to stabilize, and then get on with their living, which is really wonderful, especially for what can be a just kind of a immunocompromised population and folks that need extra support and help. So we're really incredibly pleased with those health outcomes.
Yes, well, we are too, and it's good to know that you're there. So how can people get a hold of you?
So you can just go on to kerradvantage.com, or, our local number is 804-323-9464. And again, that's 804-323-9464. And again, we cover the entire Mid-Atlantic, Maryland, DC, Delaware, and all of Virginia. And happy to help.
Oh, that's great.
Awesome. Tim, thank you so much. This has been wonderful. We really appreciate your time. I know you're busy, but I think we wanted to tell the story of a great organization with the history, like you mentioned, but with the leadership team you have now and the way you guys are running and responding. Not every company that we talk to falls into that bucket of what you guys are doing. Some are really struggling and not making good decisions, and we wanted to highlight you for making those great decisions. So thank you again for your time.
Thank you, Tim.
My pleasure. Thanks for having me.
You
Have
bet.
a great day. Bye-bye.
Bye.